Ladies and gentlemen, don't forget to wear red tomorrow. Tomorrow is National Wear Red Day as part of the Go Red for Women movement. Here to tell us why this campaign is so important is Dr. Ghazan Farkadim, Chief of Cardiology at Florida Hospital, Zephyr Hills. Good morning. Thanks for joining our football party today.
Thank you for having me.
And this is so important to talk about, for women especially. Talk about why, I want to hear from you, Doctor, and why you think this movement is so beneficial to still continuing to get the word out about heart disease and women.
Yeah. So the first thing we have to realize, and which a lot of women have to realize also, that just like in men, cardiovascular disease is the biggest killer of women. Just to give you some statistics, 33% of women actually die from cardiovascular disease or one of its consequences, like heart attack or stroke. What we do need to realize is that we may not totally eradicate it, but we can significantly lower the risk of some of these events. I would say in about 70 to 80% of the cases. And that has to come from, first of all, recognition of the risk factors and then proper management of it. So very important for us to realize that certain risk factors like diabetes, high blood pressure, high cholesterol, obesity, and smoking, most of them, if not totally controlled, can be significantly improved with, first of all, identification and then the proper management of it. So we encourage women actually to go to their primary care physicians or cardiologists to get an assessment of their own personal risk and get some of the numbers about their personal risk, including like body mass index, their blood pressure, and certain lab work, including the blood sugar, hemoglobin A1C levels, and their lipid panel and cholesterol levels.
Is it hereditary? If we've had other women in our family who maybe have suffered with this or dealt with this, is that a risk factor?
Yes, exactly. History of premature coronary artery disease, which means that if one of your first-degree relatives have had a heart attack before the age of 65 for a female member and before the age of 55 for a male member, that is considered a risk factor. But once again, like many other things, it's a combination of risk factors that increases the incidence of cardiovascular disease.
And that is, I mean, I guess kind of pun intended here, a little heartbreaking to know that so many women are suffering from this, dying from this, when essentially we from what I understand, it's somewhat preventable.
Yes, significantly, but the idea is, just as we all say, we have to know the enemy before we can deal with it. So once you recognize these risk factors, and then modification or treatment of that is somewhat of an easy job. But first of all, there is so much lack of awareness among women.
Is there a lack of awareness?
I would say so. That's why we have all these movements to help encourage them to get their own assessment of personal risk.
So at what age do we start worrying about these risk factors and assessments?
You know, actually, to look at it, the atherosclerosis, which is plaque buildup in the blood vessels in multiple territories, starts at a very young age. But most of the studies that have been done and most of the risk factors, I think after the age of 20, we should have a serious assessment of that. And we are able to control and modify these risk factors much better. And indeed, this will lead to significant reduction in the burden of cardiovascular disease.
I think it goes back to, I hear all the time, how important it is to make sure you're having these conversations with your doctor, your primary care doctor. Is that where it starts?
I think that's the first step where it starts, and anytime that we assess the risk and further management needs to be done, there's a very good cardiovascular disease specialist community in the area that we can help out.
I would say so. Well, again, tomorrow is a big day,
yes,
so if you see red everywhere, it's not meaning that they're necessarily Atlanta Falcons fans, but it's, so talk about where, because there's events going on everywhere. How can people get involved? How can they find out more, Doctor?
Exactly. So the National Wear Red Day, we just need to understand that it is the first Friday in February each year, where the idea is for people to wear red so that they can show their support for awareness of cardiovascular disease in women. And we have a number of events in the local area. One of them is going to be starting at 7:30 a.m. tomorrow on Bayshore, which is actually a walk. And we encourage people of the community and the community members to basically wear red and join us for this colorful walk.
Easy enough.
The second one, the second one is actually going to be at the shops at Wiregrass, where we have a segment from 10:30 a.m. to 1:30 p.m. where people are encouraged to come and share their own personal stories about cardiovascular disease.
That's where we're going to get that, when people can share their personal stories. Doctor, I love that. Thank you for being here this morning again to find out more information. I know you guys have a great website, a lot of stuff going on. Thank you, Doctor.
Thank you very much.